Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the Two Talk, I have Dr. Prathiba Srinivasan. To give you a brief introduction about Dr. Prathiba graduated from the Krishnadevaraya College of Dental Sciences, Bangalore. Currently, she is a professor and the head of the Department of Periodontology at Sri Venkateshwara Dental College, Bangalore. She has over 13 years of experience in teaching, and she is a consultant at various dental clinics across Bangalore. She has several publications in the topic of periodontics in national and international dental journals to her credit. Dr. Prathiba, thank you so much for joining me today in today's Truth Talk conversation, and a warm welcome to you.
Thank you, Dr. Rekha. Thank you for that introduction.
Thank
Good
you.
afternoon, everybody. Thank you.
So, Doctor, what is the topic that you would like to share with our patients today?
Today, I would like to talk about bad breath, popularly termed as halitosis. So, this is a problem which is very commonly seen in the general population worldwide.
Yes.
So, today I would like to talk about that topic, and this problem frequently brings the patient to the dentist. It is one of the most common chief complaints that brings our patients to us.
Yes, yes.
Yes. So I would
And
like
also,
to talk about that.
so I think also possibly because it's a very kind of a social stigma kind of a topic
Yes.
also, where people can't talk about it openly, discuss about it openly. So I think if they get a fair idea of what causes bad breath, then probably finding a remedy for it becomes much easier.
Yes, doctor. As you said, rightly said, halitosis has a huge psychological impact on the patient's well-being. So this patient feels conscious always, and he or she feels socially awkward, so they cannot socialize properly. So we have to keep these factors in mind when the patient comes to us seeking help.
Yes.
So, and it's a problem which can be very easily treated. So we have to diagnose the problem, ask the patient since when he or she is experiencing this problem. And when the patient comes in to us with this chief complaint of halitosis, we elicit the details. We take a detailed case history. We ask the patient since when have you been experiencing this problem, since how many days or weeks or months. Then we go about to ask the patient, did you notice this problem yourself? Or did somebody else tell you that you are having this bad breath? Did your spouse tell you, or did your friend tell you that you're having bad breath? So these things we ask. We also ask the patient some other very simple questions. When do you experience this bad breath? Is it upon awakening in the morning, or is it constant throughout the day? So at what time of the day do you experience bad breath? So these are some things which we commonly ask our patients, just to get to know the problem.
Okay, doctor, just to get a little more clarity on what exactly bad breath is, sometimes we would say there is some kind of a stale breath, which probably happens, over a period of time during the day because of
Yes.
so many activities, because of, the patient is either talking or, he's eating. So do you think everybody will have some amount of stale breath during the day? I mean, towards the end of the day.
Definitely, doctor. See, once we get up in the morning, upon awakening, first I'll address that. So we all experience a kind of fetid breath, which emanates from our mouth. So this is called as morning breath. It happens to all of us. So there is decreased flow of saliva in the night, and there's not much activity happening in the mouth during the night. So because of this, all of us experience what is called as morning breath. And once you brush your teeth, so this morning breath disappears. And then sometimes, if you are on prolonged periods of starvation, if you are fasting for a long duration of time, or if you get dehydrated, you tend to get dehydrated. So you do experience a kind of fetid odor which emanates from your mouth. It does happen. And sometimes bad breath can come sometimes before food or after food. So that gives us valuable insights if the patient has some gastric related problem. So the most common gastric related problem that can contribute to halitosis is called GERD, that is gastroesophageal reflux disease. What happens is the acid content from the stomach refluxes constantly comes up to the oral cavity. So that can emanate, that can significantly contribute to bad breath. So
Okay.
it can happen.
So suppose we consider some of them could be systemic causes. That means because of the general health problem. What other than the GERD that you mentioned just now, that is the stomach upset. Other than that, are there any other conditions that can cause some kind of a typical odor in the mouth? Uh, Doctor, you're not heard.
Can you can you hear?
Yeah, now I can hear. There's some slight disturbance. Yeah.
Should we do it again then?
No, it's okay. You can continue.
Okay. So some of the common systemic conditions that can contribute to halitosis are conditions like sinusitis, okay, rhinitis, or most commonly diabetes mellitus. If the diabetes is not well controlled, uncontrolled diabetes mellitus, it can impart one characteristic odor to the mouth odor. It's called as odor of rotten apples. So likewise, there are many other systemic conditions, uncontrolled kidney disease or liver failure. So they all impart a characteristic odor to the breath. So that can happen, but most commonly, doctor, the causes of halitosis is it's mainly due to poor oral hygiene. So poor oral hygiene maintenance by the patient for a period of many weeks or months, that can contribute to accumulation of food debris, it can contribute to accumulation of plaque, or if the patient has many big extensive cavities in his mouth, so it can all act as areas where the food goes and gets lodged. So sometimes the saliva pools or it stagnates. So it can all contribute to bad breath. And also coated tongue. The tongue, if the patients don't clean their tongue with a tongue cleaner, or if they don't brush the upper surface of the tongue, that can significantly contribute to bad breath. And
So,
these are local causes.
yes. So by and large, the kind of stale breath or bad breath that our patients would generally come to us with a complaint, the causes would be local. That means something that originates from the mouth itself. And like you
Yes.
said, it can be either a cavity or a tooth decay where bacterial activity is high and bacterial toxins are
Yes.
being released, which causes the bad breath. Or it can be something related to your gum disease, which again
Yes.
comes under your area of expertise, which is
Yes.
periodontics, where you deal with gum infections. So,
Yes.
doctor, what specifically? So, if I can talk about bad breath that emanates because of gum disease. So,
Yes.
what are the conditions which lead to bad breath that emanates in a gum infection?
People can have halitosis due to periodontitis, where they have deep pockets. The gums are not tightly attached to the teeth, so bacteria accumulate in those so-called pockets, and this high bacterial activity can lead to bad breath. Or if the patient has an abscess, a gum abscess. Abscess is nothing but a pus-filled swelling, localized swelling in relation to the gums. So that can significantly contribute to bad breath. Or many other gum conditions like necrotizing gingivitis, or even your aphthous ulcers can cause halitosis. So necrotizing gingivitis, stomatitis, pericoronitis, that is if there is a partially erupted tooth, the wisdom tooth is partially erupted. So in that area, the food can get accumulated between the gum and the erupting tooth. So that can significantly contribute to bad breath. So also you can see bad breath in patients who are smokers or who consume alcohol. For example, smokers, you have the typical smoker's breath, what we observe, or alcohol consumption. And with regard to diet, some foods like onions, garlic, or fish, that can also lead to typical odor, bad breath. So diet also does contribute to bad
Bad breath. So,
breath. Yes.
Dr. Pratibha, what do you think would be the treatment options available? So, just in case if it is because of a gum infection, like
Right.
there is a tartar deposit, which has happened on the tooth, and that has a lot of bacteria deposits on it. So, what typically would be the treatment which will give almost like an 80 to 90% relief to the patient?
Okay, so this treatment protocol, what we follow to tackle this problem of halitosis is fairly simple. It all starts with our history taking, as I told you before. So we record a detailed medical history just to rule out all the medical conditions and the systemic causes of halitosis. Then you also ask the patient how is oral hygiene maintenance, is what is he doing, how many times is he brushing, what are the aids he's using to clean his tooth. So these are some details what you can collect. And after that, we do a detailed periodontal examination. We examine the oral cavity. We look for any deposits like calculus deposits. We look for any caries, cavities, or we even look for any ill-fitting dentures or improper margins of restorations. If the fillings, what has been done, if it's very old, and if it is become rough, so it
Yes.
all favors food accumulation. It can contribute to halitosis. So we look for all these problem areas. So if we find any of those, we treat them immediately. So treatment protocol, the treatment measures are also very simple for a case of halitosis of oral origin. So if you find plaque or calculus, start with a simple professional cleaning and polishing. So that removes the major bacterial bioburden from the oral cavity, which contributes to halitosis. You have to fill the cavities and you have to correct any improper ill-fitting dentures or restorations. That has to be done. And apart from that, you have to emphasize on good oral hygiene maintenance. Having
Yes.
done that,
Yes.
so that's very important. You have to motivate the patient to maintain his oral hygiene, brush 2 times a day, use any interdental aid, for example, floss.
Floss.
And also, patient has to brush the upper part of the tongue regularly after brushing.
Yes.
That has to be done. So ideally, brushing has to be done after every meal. But if it's not practically possible, the patient has to rinse his mouth forcefully after every meal. Otherwise, brushing 2 times a day, and ask the patient to cut down on the habits like smoking or alcohol consumption. That is very important. Having done all these things, then you can even think of prescribing mouthwashes.
Yes.
So a plethora of agents are available in the market. Many brands are available, but we still prescribe Chlorhexidine Mouthwash. It's the gold standard. So
Yes.
it's a prescription mouthwash. It is the
Mouthwash.
best product. So it's prescribed for a duration of 2 weeks.
Yes.
And you have other mouthwashes which will particularly tackle the problem of halitosis. You do have those brands also. So that can be prescribed for a short duration of time. So that's about the oral causes of halitosis. But if you do all these treatment procedures, but still the patient tells you that I am experiencing a fetid odor. I still have experienced bad breath. So you have to examine the patient. You have to actually take a whiff and smell the patient's breath to ascertain if the patient is actually telling
Ha-
the truth, because there are many patients who are very adamant and who generally they perceive that they have a bad breath.
yes.
So this is called as halitophobia. Okay, so we generally reinforce oral hygiene instructions and we counsel the patient. So that's about that part. Then the systemic cause of halitosis. So if the halitosis still persists after you do all this, then you have to think of some systemic cause. So some underlying cause which you may have missed out or which has not been diagnosed yet for the patient. So that time it necessitates treatment of the underlying systemic cause. So referral to the physician becomes mandatory.
Mandatory.
Yeah, in that aspect. Yeah.
Yes. So Dr. Prathiba, that means to say that bad breath to a great extent is because of local causes. So
Yes.
Following meticulous oral hygiene, like how we have always been saying, proper brushing, flossing. If not flossing, if patients are not comfortable flossing, any interdental aids like brushes or oral irrigation devices, whatever they are comfortable with, that has to be followed regularly, because I think most of the bad breath is thing that emanates especially between the teeth area, because of accumulation that happens between the teeth area. So proper flossing and brushing at night, because the saliva flow reduces, and like you said, the chances of bad breath happening during the day, when in the morning when we wake up. So I think brushing and flossing at night becomes almost mandatory, like how you do during the daytime.
Definitely, doctor. Yes. Yeah.
Definitely. Yeah. So, and also doing things like warm salt water rinsing, and of course visiting your dentist regularly.
Yes.
Follow up with them and see if there are any causes, like tooth decay which is there in the mouth, or if there is any
Gum
area,
problem.
yes, any gum problem, bleeding gums and things like that, is something they can always discuss with their dentists.
Yes. So good oral hygiene maintenance, regular visits to the dentist, definitely you can combat this problem.
To a great extent. Yes.
Yes,
Yes.
definitely.
That talk, Dr. Prathiba, was very helpful. You did tell our patients how actually halitosis or bad breath can be, solved. It's not something that which cannot. There's no solution for it. It's just that I think the patient should realize and understand and visit their dentist and talk to them, and they'll be able to find a solution to it.
Exactly. Though this problem is very common, with proper diagnosis and with very simple treatment measures, definitely this problem can be solved.
Solve. Solve.
Yes.
So that was a very useful talk, Dr. Prathiba. Thank you so much for joining me today in today's Truth Talk conversation.
Thank you, doctor. Thank you so much.
I just hope I can get you back to share with our patients on another aspect of oral and dental health.
Definitely, with pleasure, doctor.
Thank you.
Always. Thank
Thank
you.
you so
Thank you,
much.
doctor.
Viewers, that was Dr. Prathiba Srinivasan, who did talk to us about bad breath or halitosis and how you can prevent or even solve the problem of halitosis. I hope that talk was helpful and you did understand how you can combat bad breath. If you have any questions or queries, please do write to us. Do not hesitate, and we will get back to you on that. And to know more about your oral and dental health, do log on to our website www.thedentaire.com. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. So until next time that I come back with another dentist with another topic on your oral and dental health, keep smiling, stay safe, and be happy. Thank you.